Well, here goes nothing.
Ah yes, the glucose test to determine whether or not you have gestational diabetes, the kind of diabetes you'd get while you're pregnant. Welcome to the Dekanta channel, where we discuss all things educational and we never duck away from difficult topics, including what you can expect at your glucose test. So what was that orange-colored drink I was drinking, and why was I drinking it? For most pregnant women, a glucose test, or the 1-hour glucose tolerance test, is scheduled to take place between weeks 24 and 28 of pregnancy, and performed by making said pregnant person chug a small vial, if you will, of an absurdly sweet drink in 5 minutes or less. And when I say absurdly sweet, I mean absolutely glucose packed, as in 50 grams of sugar in this tiny bottle. That's a lot of sugar. Then said pregnant person would have to get their blood drawn exactly 1 hour after chugging this very glucose-packed sweet drink and have their blood sugar levels measured. So why do this test in the first place? Well, according to the Centers for Disease Control and Prevention, gestational diabetes affects up to 10% of pregnancies and can have some pretty horrible consequences for both you and the baby if you end up having it, and if it's left unchecked. For example, some of the complications include having an abnormally large baby, meaning a more difficult birth for the mom and possibly a C-section just to get the baby out, breathing difficulties, and stillbirth. And not to mention that it also puts the mother at a much higher risk for preeclampsia. So then here's the important stuff you need to know about getting ready for this test. First and most importantly, the 1-hour glucose test is not a fasting test. But if you do fail it, then you will have to go take a 3-hour glucose test where you will have to be fasting for it. So if you're doing the 1-hour glucose test, not the 3-hour one, the 1-hour one, then do make sure that you eat a hearty breakfast before you go and spend an hour of your life in the OB's office or in the lab where you're going to have your blood drawn, where once the test begins, you won't be able to eat or drink anything else other than water. So make sure you've got yourself a nice big plate of scrambled eggs or something to that liking for breakfast before you arrive. This should hopefully help keep your belly full through the whole process and also hopefully negate any nausea you might feel from drinking all of that sugary substance all at once. As a side note here, it's also a good idea to avoid anything that's super sugary or carb loaded. So don't go eating a whole bowl of cereal, bagels, waffles, pancakes, or a nice big frappuccino before you go to this test. At least if you want your best chance for acing it anyhow. Although they will likely just tell you whether you passed or failed this test, it's still nice to know what the parameters are of you failing or passing in general. If your blood sugar level came in below 130 for some labs, or 140 milligrams per deciliter, or roughly 7.8 millimoles per liter, then congratulations, you passed. But if your blood sugar levels end up within the range of the 130 for some labs again, or 140 milligrams per deciliter, again that's around the 7.8 millimoles per liter, to the range of 190 milligrams per deciliter, which is roughly equivalent to 10.6 millimoles per liter, then you'll need to schedule for that 3-hour fasting glucose test that I mentioned earlier to determine with certainty whether or not you have gestational diabetes. And then of course, if your blood sugar is at or above that 190 milligrams per deciliter value, then you likely have gestational diabetes. So if you did fail that 1-hour glucose test, and you were still within the range that was lower than the 190 milligrams per deciliter, then how does that process look for measuring your blood sugar? Well, the 3-hour fasting test will go as follows. You'll be fasting before the appointment, and when you arrive to the appointment, they'll draw your blood first thing. Then they'll have you drink that same sugar-loaded sweet drink that you drank before, again, within the 5 minutes or less. And then they'll draw your blood 2 more times over the course of the next 2 hours. So that's a total of 3 blood draws in 3 hours. Isn't pregnancy so much fun? Speaking of just how fun it is, the acid reflux has just continuously gotten worse. One night this week, I basically had vomit just lingering in my throat and my mouth the entire night. I don't think I slept more than 3 hours that night. I had to prop myself up on a bunch of pillows and sleep at a nice incline just to sort of stop the vomit from being in my throat. And from there on forwards, I've decided to not eat anything after 6:30 p.m. to try and stop this horrible acid reflux phenomenon. And also, I am sadly avoiding all spicy foods to try and stop the reflux as well. So no more hot Cheetos for me. The real estate space for my stomach contents has shrunk considerably, and it's quite noticeable that if I eat anything larger, like a larger meal, instead of just picking here and there, I end up throwing it up. So that's kind of fun because there's just not enough room in my stomach anymore to contain large meals. My SI joint is still an ongoing issue for what seems like forever, but the chiropractic adjustments once a week have certainly made it more manageable to deal with. And on a positive note, I've actually slept better this week than I have for pretty much the entire pregnancy. Ironically, having my belly be bigger actually is to my benefit. The way I sleep is kind of like a half twist on the lower half of my body and sort of on my side twisted on my upper half of my body. So my belly, when it's bigger, actually acts like a fulcrum to help keep me in that position. So it's pretty great, actually. And what does our little fulcrum look like now, and what are they up to in there? At 39 weeks, our baby is now roughly the length of 14.5 inches or 37 centimeters, which is roughly the length of the celery stalk, as shown in the model here. Our baby is also likely just under 3 pounds, so probably somewhere around 2.75 pounds, or 1.25 kilograms. The biggest and most important thing going on with our baby right now is that they are putting on all of that weight. They are putting on fat and giving them a nice healthy weight gain, which is also helping their muscles get stronger as they move around, which you've likely felt multiple times with them impaling you from the inside out. Their head is also growing in size thanks to all of that brain development that started last week. And their lungs are further developing and maturing. To sustain all of this growth, make sure that you are still eating the proper nutrients and getting plenty of rest. So make sure you're getting lots of proteins, your folic acid, especially your prenatal vitamin, as always, vitamin C, iron if you need it, calcium, and so on and so forth. Well, we certainly hope that you pass your glucose test and that you're not horrified of needles like I am if you happen to not pass it. Did you feel nauseous or have any other side effects after taking your glucose test? Or did you feel like it was the worst drink on the entire planet? Maybe it didn't bother you at all. Tell me about your experience in the comments below. These videos take quite a bit of time to make, but it would only cost you 1 second to like this one. To join me next week in the super simplified Science of Pregnancy series, all you have to do is subscribe. Thank you for watching, and see you again next week.